On this picture of an aquarium, you would think that there's just water plants in here, when in fact there's actually a hidden seahorse. Just like in this aquarium, there are hidden hazards where you work. You may not realize it. The three most prevalent ones relate to your work tasks, your work schedule, and job stress. Workplace stress usually results from an imbalance between the job demands on the worker and the worker's capacity to meet those demands. But what we don't realize is that workplace stress impacts other health conditions and increases our risk for musculoskeletal disorders. There's two kinds of stress, eustress and distress. Eustress is actually a positive form of stress, and we see this in situations such as getting ready for the holidays or trying to prepare for a promotion. These kinds of stressful events actually give us a competitive edge and actually end up with a more positive outcome. Distress, however, has negative implications. You notice on this graph that there is a relationship between stress and performance in the workplace. At some point, stress does have the ability to allow us to respond to it in a positive way. But once we meet the maximum tolerance level, stress actually then results in our performance level falling off, and now we have a bad response to the stress we're experiencing in our workplace. What are work-related musculoskeletal disorders? These disorders are not the result of an acute event. They are actually the result of a more gradual chronic development due to our exposure over time to injury risks. Work-related musculoskeletal disorders are not related to one specific task, and the treatment of these disorders is very difficult to predict. Often they recur after years or even decades after treatment. Work-related musculoskeletal injuries differ from other workplace injuries such as cuts, needle sticks, and slips and falls because they cannot be attributed to a specific work task. In these other types of injuries, the results of recovery are predictable and these injuries are treatable. The incidence of work-related musculoskeletal disorders has changed over the past 11 years. In 1997, a survey done in the United States showed that 81% of sonographers were scanning in pain. 28% of the respondents reported that their career had been affected by this disorder. The survey was again repeated in 2008, and the incidence of injury was 90%, with 14% of those responding having had changed their job as a result of this injury. So why have we seen an increase in the injury rate over the past 12 years? Part of it is that employees are more aware of this injury and what causes it, and are more willing to report it. They are less tolerant of working in pain, and also they have longer work hours and higher numbers of exams to complete. There is some factor related to job dissatisfaction, but overall, one of the biggest factors is aging. The median age of sonographers is 45 years of age, and this is an increase over the past 12 years from 42 years of age. And you can see from this graph, a large percentage of sonographers are between the ages of 40 and 60. So what does that mean for us? Peak muscle strength for both men and women is reached between the ages of 25 and 35 years. So in reality, 68% of sonographers are over 40 years and are working beyond their years of peak muscle strength. In addition, the increased number of exams, or the increase in our production, has made a big impact on injury rates. You can see from this graph that from 1992 to 2005, there's been a 57% increase in the number of ultrasound cases performed each year by one sonographer. However, the primary cause for this increase in the injury rate is the technical advances in medical imaging. Our equipment has become computerized, our exams are digitized, and we have filmless image acquisition and storage. All of these factors have led to a more frozen relationship with our workstations, and we don't have to move to perform our work tasks. This changing work technology started with the assembly line that Henry Ford created for his auto workers. They no longer had to get up to get parts to perform their job. Everything came to them. The increased use in technology leads to a decrease in the need to move to perform the work tasks, and as I mentioned, it causes a frozen relationship between the user and his or her equipment. Work-related musculoskeletal disorders develop for a couple of reasons. Excessive use, frequency of the repetitive motions necessary to perform a task, the duration of the load on your tendons and muscles, the level of your muscular activity during your work tasks, and insufficient recovery time all contribute to the development of these injuries. 42% of hospital imaging departments are understaffed. So the impact of this injury contributes to our staffing issues. It also affects the quality of patient care and impacts the financial viability of a department. In addition, there are personal, financial, and emotional strains on the sonographer. In addition, it has an impact on your leisure activities and on your ability to perform household duties. There are direct costs associated with this injury, and these are related to the cost of medical care and the cost of workers' comp insurance. The mean cost per case of an upper extremity musculoskeletal injury is over $8,000 versus $4,000 for all other types of occupational injury. The medical cost to treat a shoulder injury without surgery for one injured sonographer is $20,000 a year. These direct costs are increasing twice as fast as other benefits. One of every $3 of workers' comp costs are spent on work-related musculoskeletal injuries in the United States. These injuries cost employers up to $20 billion a year in lost work days. Claims per injury can be as high as $32,000 per year. The risk factors for this injury depend on three things. They depend on the duration of exposure to the injury risk, and in ultrasound, that's how long are we scanning, the frequency of the exposure to the risk, which is how often or how many exams, and the intensity of the exposure, and in ultrasound, that's how much pressure are you using during your exam. Other factors that increase the risk are when we perform one type of exam all day, the computerization of our equipment, which again has allowed us not to have to move to perform our work tasks, improper use of ergonomic equipment, not using the features of our workstations. Some of our leisure activities can contribute to this risk, and some physical personal factors such as age and body mass index. The injury-producing activities in sonography include overuse, awkward postures and movements, forceful movements, and improper and static body positions. This list is a list of the conditions of work-related musculoskeletal injuries in sonography. Tendonitis and tenosynovitis often go together. Tenosynovitis is inflammation of the sheath around a tendon. De Quervain syndrome is a particular type of tendonitis of the thumb. Carpal tunnel, cubital tunnel, and thoracic outlet syndrome are all nerve entrapment syndromes. Epicondylitis is inflammation of the epicondyles of the elbow. Trigger finger results from entrapment of a tendon within the tendon sheath of the finger and then prevents you from being able to straighten your finger. Often this is related to gripping the transducer. Bursitis and rotator cuff injuries affect the shoulder, and we're seeing an increasing incidence of spinal degeneration among younger sonographers than we have in the past. Cubital tunnel syndrome results in pressure on the ulnar nerve caused by elbow flexion and twisting of the elbow. This syndrome can cause pain and numbness in the fourth and fifth fingers. Often pressure on the elbow by leaning on it, for instance, as in this example, can damage that nerve as well.